Hello, how are you?
Hi. I'm okay.
How are you? Very well. My name is Vanessa. I'm going to be your nurse today.
Nice to meet you.
You as well. And what is your name?
Linda Smith,
Okay, date of birth.
5/21/91.
Okay, perfect. And what brings you in today?
So I haven't been feeling really well. I've been feeling very fatigued and lethargic. I don't have a fever or anything. I just feel very sick. And my tonsils are really swollen. Just not feeling the best.
Okay, and are you taking anything for it?
I've taken Tylenol here and there, but it hasn't really helped.
Okay, and when did this all started?
About a couple weeks ago, to be honest. I just haven't had the time to go to the doctor.
Okay, and when was your last menstrual?
It was about a month ago or so. It's kind of weird. I haven't gotten it in a little while.
Is that normal for you?
No, it's not normal, but I'm sure it's from stress or something.
Okay. Have you had the flu shot?
I did. I got the flu shot about a month ago.
Okay. Have you received any kind of medical attention elsewhere, like past history of any surgery or
No
chronic illness?
surgeries. I do have depression and anxiety. I take Wellbutrin for depression and Xanax for anxiety, but other than that, nothing else.
Okay. Do you have any allergies?
I have a penicillin allergy.
Penicillin. Okay. Do you smoke?
No smoking.
Okay. Okay, so the NP will be with you shortly.
Okay, thank you.
Hi Linda, how are you doing today? What's going on?
I feel like I have the flu. I'm just not feeling the best.
I'm sorry to hear that. Any fever?
I don't think so. I feel kind of warm-ish, but I haven't checked about it.
Alright, you said this is going on for a couple weeks?
Yeah, I haven't been feeling the best.
Well, I'm sorry to hear that. And it says here that your last menstrual period was a couple months ago. Is that normal for you?
Well, it's kind of weird for me. Usually mine's always on time, but I'm sure it's from the stress and the flu or the cold, whatever I have.
Are you sexually active?
Occasionally, yes.
Okay, so I'm going to run a couple tests. I'm going to get some urine from you. And then
Why do I need a urine test?
just to see if you're pregnant or not. It's a pretty routine thing in women
Well, I
of
know I'm
reproductive
not,
age.
but
Just to double check.
okay.
You never can be too short.
Right.
And I'm also going to run a mono spot to test if you have mono, because I know that can sometimes make you feel really tired and achy.
Yeah.
And it's unlikely that you have the flu, but we're going to run a swab for that too, okay?
Okay, that's fine.
All right, my nurse will be right back and we'll get those tests started for you, and I'll be back in just a couple minutes, okay?
Okay, perfect. Thank you so much.
Perfect.
Linda, you're pregnant.
You're pregnant.
Oh my gosh, this is terrible. I can't believe it.
I know it's a lot, but there are researchers out there to help you. Do you have any help at
You
home?
don't understand. Like, I'm not supposed to be pregnant right now. I mean, I have my stepdad at home, but I have nobody else. I work at Walmart. I make minimum wage. I don't know how I'm going to care for this kid. And there's no way my stepdad can find out about this.
Well, obviously we will keep your medical information private. It's something that only you need to know about. But you do have some choices to make. But I want to run some more blood work while you're here.
Why do we need more blood work?
We can figure out how far along you are, and we can also figure out, make sure everything else is going on, because your mono spot was negative,
Okay.
and so was your flu test. So I just want to make sure everything else is going on. There's no other weird disease process
At
going
least
on.
there's nothing else, and I'll figure out how to deal with this.
All right, well, know that I'm here for you, and we're here to help you make whatever decisions that you need to, okay?
Okay, thank you.
I'll call you back in a few days once I have the results of the blood work,
Okay.
and we'll figure it out from there, okay?
I only have a home phone. You can call my home phone?
Yeah, absolutely, and we'll make sure we talk just to you.
Okay, thank you.
Okay, perfect. I can speak freely?
I think I'm sure, yeah.
I'm sure it's fine.
Okay, Linda, so when I was running the blood test for your pregnancy,
Yep. Wait. You're pregnant?
Yeah, I'm pregnant.
When are you planning on? What were you planning on telling me?
You weren't supposed to find out.
Where did you get that from? Where did that happen?
What about the test?
while I was running your blood work, it became evident that you were HIV positive.
And where did that
Oh
come
my
from?
God, it came from you, Dad.
How
You gave
from
me
me?
HIV and you
It's
got
an
me
STD.
pregnant.
I don't have any STDs.
You're the one who shoots up heroin on the side with your needles. I don't know where you
Oh.
get them from.
Oh, way to put
And
me
you
on the spot.
definitely gave it to me.
We can discuss testing you after, but we're here for Linda right now, and
Now I don't know what to do. How do I fix this?
so we're gonna get you started on a cocktail of drugs.
Isn't that like a drink? A cocktail?
No, Dad. A cocktail is like a mixture of 3 or more medications.
That's absolutely right, Linda. I'm gonna get you started on something called HART, which is highly active antiretroviral therapy. And so it's gonna be a cocktail of 3 different medications. The first one I'm gonna start you on is called ritonavir. It's a protease inhibitor, so the way that it works is that it interferes with the reproductive cycle of the HIV virus, so it doesn't spread. So it helps increase the ability of your immune system to work well and prevent you from getting any other infections.
So you're saying with these medications I'm not going to get AIDS?
That is absolutely our hope. There's no guarantees, but if you take your medication as prescribed, we can help keep your viral load low and your T cell level high.
Okay.
So you're gonna take this, it's a 300 milligram tablet, and you're gonna take it twice a day with your food.
Okay, so you swallow it whole, you don't break or crush it. Some side effects that you might experience are dizziness or nausea, but we're hoping that with the food that you consume, it's gonna minimize that. Some other things we're gonna look for is if you can just alter your diet a little bit to increase the calcium and vitamin D. And if you could go on
So
that.
do you have to drink a lot of milk or?
Very good, milk is good.
Yogurt, cheese.
Okay.
Very good. Also, it's gonna increase your sensitivity to the sun.
So she's just gonna need some sunscreen and a hat.
And some protective clothing if you could just minimize your interaction with the sun really. Please do contact your provider if you have any rash or jaundice. Do you know what that means?
Is that like when your skin gets really
Yeah.
yellow?
Yeah, very good. Your skin and your eyes, if you have a fast heartbeat, or if your face starts to swell along with your lips and throats. Sorry.
If your lips and your throat start swelling, don't contact me, call 911, okay?
Should I look out for this kind of stuff too?
Obviously, we all want to be proactive and make sure that Linda gets the best care possible.
I live with him, so I'm gonna need some help.
All right. So the second drug we're going to start you on is a combination drug. It's called emtricitabine and tenofovir. And this is, I know it's a lot, but we're going to help you.
Yeah.
And it's a
Nucleoside replicase transcriptase inhibitor. So this also helps prevent the multiplication of the HIV virus by inhibiting the DNA synthesis. of
So
the
all these
virus.
medications sound like they just do the same thing. Why are you giving 3 of those?
Sometimes certain drugs work better than others by combining different medications at once. We're able to help keep her viral load low. Sometimes even to the point of being undetectable.
That's great. That makes me feel a little better.
So you're gonna take this drug. It's gonna be a 300 milligram tablet twice per day.
Twice a day this time.
Yep, twice a day.
Okay, and this, we're still gonna monitor you for any kind of liver issue that you might be experiencing.
Like jaundice?
Very good. Like jaundice again, increased sensitivity to the sun as well. If you can just pay attention to your stool, we're looking for like any kind of grayish color change.
Okay.
It's okay, we'll take good care of you. And any abdominal pain in the upper right quadrant.
Abdominal pain is it?
Your baby's
That's where your
fine.
liver is.
Okay.
Exactly. Very good.
Exactly, it is where your liver is. So we're gonna keep monitoring that. Another thing that we're worried about here is your kidneys.
Why?
A lot of drugs are processed and excreted, like the metabolites are excreted through your kidneys into your urine. So we're just gonna monitor your kidney function.
Okay.
And then our final drug that I'm gonna start you on right now is called raltegravir, which is an integrase inhibitor, which also does a very similar thing. It helps decrease the replication of the HIV virus within a cell, so it can't spread to other cells. And you're also gonna take this twice a day. It's gonna be 400 milligrams.
And do I have to take it with food?
No, you do not take this with food.
Okay.
And what is this all gonna do to the baby? Is it gonna get rid of it?
No. So I don't know if you've heard of pregnancy categories.
I think I've heard of.
I remember when your mother was pregnant, they had a lettered chart.
Yeah, absolutely right. So drugs are divided into multiple categories based off of how safe they are based on research studies. So
What
A
category are these?
is the safest, but most drugs fall between the B and the C category. So all of your drugs that I'm prescribing today fall in the B and C category. So in this case, I do think that the benefits do outweigh the risks to the fetus because
Okay.
we're trying to prevent the spread so you can live a long life and so the fetus doesn't develop HIV as well.
So you're telling me if I take all of these medications combined, I can still live a normal life?
Absolutely. You're gonna have to come in for a little bit more testing, more than someone else, and you're gonna have to make sure you keep yourself healthy because you are at a higher risk for developing infections. But if you follow your medication regimen and we work together, I think that this is a very manageable disease now.
Or taking any kind of like other vitamins or nutritional supplements, herbal remedies, please do contact us before you take anything. Especially St. John's wort. I know that you're a little anxious sometimes.
Yeah, I'm
But-
very anxious, but I don't take that medication. What does that do?
It actually decreases the efficacy of the drug, so
Oh,
they
no.
aren't able to do what they're supposed to do as well, and it puts you at further risk for viral replication. And so
What
we
does
don't want that.
efficacy mean?
Efficacy means how effective the drug is, and so it decreases how well the drug is working. And in the case of HIV, this is not something we really want to mess around with. We want to make sure that you're able to live a long life. HIV is not the death sentence it once was, and we're gonna make sure that you are able to get through this. Okay?
Thank you.
Also, you might experience some kind of sleep and difficulties. But please do not take any sleeping pills or dietary supplements.
Okay.
It is not good for you or the baby.
So you recommend that I don't take any other medications while I'm on these 3 drugs?
Exactly.
Not unless you clear
Yes.
it with either me or one of your other doctors.
Okay. Perfect. Sounds great.
We'll take very good care of you.
Thank you so much.
That took time.